It's very nice to be here and to see that we are talking about patients, So it's rather infrequent, rare, but still, it's a good beginning. So I agree with all that Professor Talwar was mentioning, and all of us know that this is rampant. People being guided by social media and all kinds of the practices we saw a short while ago on those video clips. And I work at the All India Institute, but also, I do a lot of outreach work, which is in very underserved states of Chhattisgarh, Jharkhand, etc. And I get to see all that's happening, in our country. So I think our very basic problem in this regard is that we have a very low health literacy. We've never paid much attention to very basic health information. I wish that I'm not sure we are working on the education policy, but that's in an entirely different direction that we are taking it. What probably is very urgently required is that everyone have at least some basic sense of health and disease. I'm not saying that everyone needs to be made a doctor when they are in school, but like knowing we are like going to have or already have epidemic proportions of non-communicable diseases, hypertension, diabetes, but very very unaware of very simple practices that can keep these diseases away. So a little health literacy efforts may go a long way in ensuring that when people encounter such misleading information on internet, they are not as gullible and as ready to pounce on every remedy that is being offered. So that is a very basic thing, and the to address it, of course, would be mean that we introduce some forms of health education. At every level, people know what has to be done, what can very easily be done by just changing lifestyles, and we can avoid so many diseases rather than waiting for it to happen and then try to get treated. I also identify, it may kind of not seem very good to people, but I think hyper religiosity in our communities. So anything sold in the by a Babaji or from a mandir or a dargah or a place of worship or somebody clad in saffron robes is considered kosher. It's very rarely challenged, or it's just we are so kind of steeped in religion that it and religion generally stumps or trumps science. So people are very willing to believe something that a sadhuji or somebody is peddling, and more often than not, these are all just scams, and many very often even do forget about getting benefit. They do damage or harm. We have enough patients coming with renal failure because of some vibhuti that somebody has consumed. So please be very careful. Now again, this goes back to being health illiterate, that why are you so gullible and vulnerable to such kind of approaches. uh, I would also hold myself and my community responsible to some extent. We we hide behind the great or the large patient numbers that we have, and so we spend very little time because that's all we think we have. We do struggle to kind of run very busy clinics, so we do not communicate with patients, and that communication gap leads the patient to other avenues, very often to readily available online resources, and that's where they will generally find things which may be dangerous, even dangerous. uh, and of course there is no fear of any consequence, so anyone posting anything or anywhere is, I don't think they have even a worry at the back of their mind that if somebody does badly, or somebody fares whatever disease condition doesn't do well, I will have anyone coming after me. There's no such fear. I don't know if there is a law, but I don't know how it works. So that probably no fear of any kind of a reprimand or any kind of a consequence of what you are posting and what you are doing, playing with people's health, makes it a very a good ambient and environment for players of this kind to meddle with people's health.